Because that is part of the problem, isn't it? You know, is that sometimes people see this as a democratic or worse, a lefty liberal position. You hear that lefty liberal thing. And you have to get past that with folks. And I think Chuck Pinocchio, a young fellow in Pennsylvania, is the one who's chiefly responsible for thundering through where no one else has gone, getting Republicans on their bill. And how he's done it is done it with a couple of things. With the Healthcare Now win-win program and going in and helping calculate the difference in cost to local governments, state governments, if they went with a single payer plan as opposed to doing what they're doing now. How much money would they save? That's very compelling. When you show them right now in their positions of budget crisis that they can save millions, sometimes billions of dollars, that's very compelling. So Healthcare Now, it's nonpartisan. There's no partisanship there. PNHP, Physicians for a National Health Program, is not a partisan site at all. They never, to my knowledge, put a partisan position in an issue. And they also have terrific data, terrific education materials for single payer. So, PNHP.org. PNHP.org. CalNurses.org is my organization's website, also highly nonpartisan. We are very careful about that. And you have to go to our Guaranteed Healthcare site. I actually read all the patient stories that come in on that site. We still have patients who send stories constantly. And I read every one of them. I don't even know how Michael Moore's folks read all what they read. It is heartbreaking. There are days when I have to get up and walk around the block and cry or get angry, or I don't know how doctors do it. I don't know how you do it, because it hurts. It hurts to see all this human suffering that you know could be stopped. So those are some of the sites I would go to if I was going to try and educate, and I do. When I was riding here on the plane, I came in from San Francisco to Seattle. I was sitting in a row with a guy who thought himself a libertarian, a young man, and an older woman who was conservative, but not Sarah Palin nutty conservative. Conservative. Very nice people, really kind people. Not nutty, but very concerned about the direction that healthcare is going. These are the fellow citizens we have to talk to. And we have to be able to talk to them without being judgmental and hear their positions, hear what their worries are. Don't worry about the folks who are over with Rush Limbaugh. You're never getting them. We don't need them. You don't need them. This nation was not formed on 51% loving the Declaration of Independence. Truly, if you read through history, and I was a history major, I think there are other history majors here, about 30% of the people in this country wanted to stay with the King of England. About 30% really didn't care. And it was the rest of us who said we want an independent nation. We don't need all the Rush Limbaugh people. You're going to waste time if you try and get with that far right. You really will. You'll spin your wheels. There's plenty of people who don't know what we're talking about yet. They don't understand, but they understand Medicare. You can talk to them about Medicare. You can talk to them about Social Security. That is the next huge hit coming our way, folks. Pay attention to that deficit commission that the president has put in place now without any elected officials on it. Nobody accountable to us. Nobody. And they've been told already that everything's on the table to cut those nasty entitlements, right? We go through this every 15 or 20 years, don't we? That we're going to slice Social Security because it's going broke. It's not going broke. The trust fund is not going broke. We have to, if we can't protect Social Security and Medicare now, we sure as hell won't expand them. So watch that. Be very vocal with your legislators saying, I do not want anything to happen, and I will fight you and anybody who does to Social Security and Medicare. So there are lots of ways you can weigh in nonpartisan ways that others will understand. Other people don't want their Social Security and Medicare cut. Believe me, they don't. And who would I ask to design the best healthcare system possible for this country? That's a tough question, because I often will tell people I don't see the payment mechanism, and I think most folks would agree with me, is not the only problem. It definitely, from a patient's perspective, oh my God. The specialization of medicine is such a problem for patients. You know, we often can't even get somebody to think about our whole body system. You end up seeing somebody for a foot, somebody for an arm, and somebody for a heart, and it's not just one heart, an invasive, a non-invasive, a surgeon, and this and that, and you can't ever get somebody who takes a look at the whole system. That's a real problem for patients, a very desperate problem. The overuse of drugs is a problem. Oftentimes you're prescribed. I always feel like it's a crapshoot now when I take my husband to the doctor, whether he's actually going to get what he needs, or is he going to get just what they've decided the revenue needs to generate that day. And if you even suggest that to a doctor, ooh. We have to get to a point where patients are in control of what happened to patient bodies, and we're nowhere near that in this system. It's going to take a while. We need an awful lot more good doctors like Chris to speak up and say there are a lot of greedy docs in the business. And thank you. If you didn't hear in his story, I was listening very carefully. This man had a private practice. He could be making a lot more money. And he took a very principled stand in his life. And we need so much more of that in American medicine, and it's going to take doctors talking to other doctors too, which is very hard, because they're very stubborn. As stubborn as they are with we patients, I'm sure they're more obnoxious with each other, aren't they? Yep. Yes, I'm sure they are. So we need that systemic change too. And I'll leave you with one other thought. There are a lot of ways to go at this problem. My organization, American Patients United, you can always visit there, americanpatientsunited.org. I'd love to see you there. We are party to 3 lawsuits in the state of Illinois. Not malpractice lawsuits, but against large medical provider organizations that call themselves nonprofits. Because these hospitals, many of them huge nonprofits, take their nonprofit status, so they don't pay property taxes, they don't pay the same taxes as anybody else does, their same full boat as any other business does, on the basis of providing a certain level of charity care. Yeah, you follow what we found in Illinois, at least, was there were a number of these huge nonprofits that were not providing anywhere near. In fact, not only were they not providing charity care, the uninsured patients were charged more for their services and sued more frequently, right into bankruptcy. That's not providing charity care to the level that should give you any kind of nonprofit status in this country. So we became party to 3 lawsuits against 3 large hospital corporations. So there are ways to push it. And the last thing, another way you can check and be very proactive, Rob Stone, Dr. Rob Stone in Indiana, wonderful ER doctor who's great. He's also a shareholder for WellPoint, believe it or not. Can you believe it? But they did that purposely so that they could get into all the shareholder meetings, which is very smart, very smart. Anyway, he's running this divestiture program. You know, a lot of our pension funds, a lot of those of us who have any savings or pensions or anywhere, you can track some of those funds to being invested in health insurance companies. Demand that they divest or move your money. If you're in that, I'm not in that boat. I don't have any money left to do that with. But if I were, I'd demand that they take my money out. And if you know people who can, let's start hitting them. The only place apparently they really hear is money. So there are lots of ways that we can start going at them at the same time while we fight this critical human rights battle, that we care enough about one another in this country. And I promise you, I'll give you my Pollyanna statement for the evening. Been to 43 states in the District of Columbia with rooms all over the country just like this, with people who care about their neighbors. And we care about each other, we really do. It's a good country. We're all trying very hard, and the scales of justice are just tipped the wrong way right now. And some of us are throwing bucket loads on top trying to change it. Some people are throwing a spoonful, and some people are just able to throw a grain with a letter once in a while, or a call to a senator, or a call somewhere. But none of us knows which grain of sand is going to be the one that tips it over. So just because you can't go do 100 things, don't worry about it. Do something. Talk to one neighbor. Take one friend to a meeting like this, because we got to get more out there than we are now. We can do this together, but we got a long struggle ahead. We're going to make it happen. And again, thank you very much.